Glaucoma used to be a very reactive disease. What do I mean by that? Well, we wait for there to be optic nerve damage, then we treat it with the hopes of the pressure going down, wait for there to be more nerve damage, treat it, hope the pressure stays down, all with the hope that by the time the patient's at the end of their life, they still really have good functional vision. But that's a reactive way of looking at it. Can we be more proactive? How about we not wait until there's active damage and we treat it ahead of time? Instead of allowing damage to occur and having the patient even have any functional vision loss, regardless of even going blind from glaucoma, there's a better way of approaching it. What interventional glaucoma allows us to do is just that, take it from a reactive disease to a proactive disease. But what that requires of you as the physician is to think about the disease differently. Instead of just waiting for there to be damage to occur and then reacting to it, ask yourselves, are there better ways of intervening in this patient's care where we can prevent that from happening at all? The best analogy that I give for those of you that are football fans, imagine your team is the underdog and they're actually winning at the end of the game. What's the most annoying thing that they do? They go into what we call prevent defense, right? They were playing so well, but they decided, we're just gonna hope not to lose. They kind of loosen up on their defense. What does that do for us as fans? The game gets closer and closer, so we get super anxious, and sometimes your team even loses. Well, glaucoma used to be a lot of prevent defense, right? Wait for there to be nerve damage, all with the hopes of by the end of the patient's life, they're still gonna have functional vision. They're still gonna see well. Well, when it comes to glaucoma, if you think of it that way, the patient's gonna have some functional vision loss, and sometimes in the worst case scenario, they're gonna go blind. But you don't have to play like that anymore in glaucoma. The reason why that is you're no longer the underdog. You actually have the tools at your disposal so you can play to win instead of playing to lose. The key though is, are you thinking ahead of time, what are my options that are available? And being open to different solutions on how to address the problem so you can change the strategy of how you approach it. And I think you owe it to your patients to at least think outside the box and offer them these options so you can really maximize the quality of care.